Welcome back to TV5 News at 9. Today in health, we're focusing on prostate cancer, the second leading cause of cancer death among men in America. And calling in this morning to talk about prevention, screening, and treatments is oncologist Dr. Sandeep Grewal from Karmanos Cancer Institute at McLaren Flint. Thanks so much for being here.
No, thank you so much for having me.
So Dr. Grewal, tell me, how common is prostate cancer?
So again, prostate cancer is the most common cancer in males here in America. And it's the leading cause of cancer, accounting for about 29% of all cancers detected in men. And the incidence increases the older you get. So they have done autopsies on men, and in your 50s, almost about 30% will have small amounts of prostate cancer noted on biopsies. And by the time you get to your 80s, that risk can increase to up to 70%. So looking at the statistics, it is estimated that almost 313,000 of new cases of prostate cancer will be detected in 2025. So that is indeed a huge number.
Very. What steps can men take to catch this early?
So the most important is to have a screening, which is generally done by a blood test called the PSA, or the prostate specific antigen. That is a test that the primary care generally discusses with the patient and order. And generally, we recommend the screening test to start at age 50. There will be some men who will be considered higher risk. For example, if you have somebody in your family who has been affected by prostate cancer, studies have shown that African American or Black males have a higher incidence and higher complications from prostate cancer. So for those people, it is recommended to start screening at 40 to 45.
All right, good age range there. Now, men diagnosed with prostate cancer often say their oncologist suggested taking a watchful waiting approach to prostate cancer rather than just diving into treatment. Why watchful waiting? Why is that?
Yes, that's a very good question, and it's very important for patients to understand that when it comes to prostate cancer, you have a lot of choices. There's just not one shoe that will fit everybody. So it's important to talk to your doctors and your oncologists about what your treatment options are. And watchful waiting was a term we used a lot in the past, and now we are moving towards active surveillance for those patients. So it's the same concept, but what the concept entails is that not all prostate cancers are equal. Just because you detect prostate cancer on a screening test or a biopsy does not automatically mean that you will have complications from it. It may never reach a stage where you have symptoms or you can die from it. So there are risk stratifications, which are based upon how the cancer looks under the microscope, what your screening test number, the PSA was. Generally less than 10 is considered good. So for most of those patients, we do recommend that it's better to actively surveil them rather than actively treat them, because their quality of life will be better off treatment rather than on. And a lot of them may not even require treatment during their lifespan. So you spare them the side effects associated with treatment.
And that's a great reminder, too, that every case does look different. What are some of the more effective treatments for prostate cancer?
So generally, the treatment can be divided into 4 categories. The number one that we just discussed is do nothing or just actively surveil them. Number 2 would be surgery. That is called prostatectomy, where the surgeon just goes in and removes the prostate. They try to remove some lymph nodes around the area to make sure that the cancer has not spread. The third important one would be radiation. And here at McLaren Karmanos, we do have the proton therapy, which is a safer way to administer radiation with less effects on quality of life and less side effects. The fourth would be hormone treatment, which would be injections, which are generally given every 3 to 6 months.
Well, Dr. Grewal, how can someone get in touch with you or another cancer specialist at Karmanos Institute?
So they can call us at our phone line, which would be 810-342-3800, or they can go to www.mclaren.org/Flint cancer, and that will take them to the Karmanos website for Flint.
Well, thank you again for all of this insightful information. You can always find more on this topic on our website. Just go to the hot link section, WNEM.com. Thank you again.